Hello, thank you for taking the time. Let me start with a simple question. What if workforce health was not a cost center, but a measurable performance driver? That's exactly what we're addressing with Briea. This is not just another wellness initiative. This is a fully integrated platform covering mental health, fitness, nutrition, lifestyle, disease management, and diagnostics, all designed with one objective: translate health into business performance. Let's look at what's really happening inside organizations today. We're seeing 62% burnout levels in India. That's nearly 3 times the global average. At the same time, 70% of employees already carry lifestyle risks. And what's even more concerning is chronic diseases are now appearing almost 10 years earlier. So this is no longer a future concern. This is already impacting your workforce today. And if we're honest, this is no longer just an HR topic. This is a boardroom-level issue. Now let's connect this to numbers that matter. Absenteeism alone is costing corporates massively. But the bigger issue is something we don't see easily: presenteeism. People are at work, but not fully productive, and that cost is 2 to 3 times higher. Add to that attrition. Replacing one employee can cost up to 60% of their salary. So when we step back and look at this, this is not a soft issue. This is direct pressure on your P&L and EBITDA. Now here's the contradiction. Most organizations already have wellness programs, gym memberships, apps, sessions, and a lot more. But let me ask you, are they really delivering outcomes? Data says no. Adoption drops within 30 days. Employees are disengaged. And most programs are reactive. So what we really have is availability of solutions but absence of impact. The real issue is actually very simple. Employees already know what to do. They know they should exercise, eat better, sleep well. But they don't do it consistently. So the problem is not awareness, it's execution. And without daily engagement, follow-ups, and accountability, behavior doesn't change. And if behavior doesn't change, health outcomes don't change. So the shift we need is very clear. We need to move from wellness programs to behavior execution systems, systems that engage continuously, nudge intelligently, build habits, and track outcomes, because when that happens, you see real results. Lower absenteeism, lower attrition, and higher consistency. That's the shift Briea is built for. So let me introduce Briea in one line. Briea is a proactive 24/7 AI health coach. And the keyword here is proactive. It doesn't wait for employees to open an app. It reaches out. It reminds. It follows up. It ensures things actually get done. So instead of depending on motivation, Briea drives execution. Let me repeat, Briea drives execution. Now let's look at coverage. Briea brings together 6 critical areas: mental health, fitness, nutrition, lifestyle, disease management, and diagnostics. Why is this important? Because these are not independent. They are deeply connected. And if you solve them in isolation, you don't get outcomes. Briea solves them as one integrated system. Let's start with mental health. We all know burnout is rising, but what's typically missing is continuous tracking and intervention. Briea uses globally validated tools PSS10, JD7, PHQ-9, and others. But more importantly, it follows up every week. It guides improvement. It tracks progress. So this is not awareness. This is measurable mental health improvement. Now fitness. Everyone starts. Very few sustain. That's the gap. Briea ensures consistency through daily nudges, structured routines, DIY, and coach-led options. So we're not just initiating fitness, we're building a habit. Nutrition is directly linked to energy and productivity, but generic diet plans don't work. Briea provides personalized plans, disease-specific guidance, and continuous follow-ups. So again, not just advice, but actual adherence. And that's where performance improves. Now let's address root behaviors: sedentary lifestyle, sleep issues, smoking, alcohol. These are major productivity drains. Briea actively manages these through tracking, nudging, and habit correction. So what you see is better energy, better consistency, and better day-to-day output. Chronic diseases are one of the biggest cost drivers, and they're increasing. Briea ensures continuous monitoring, medication adherence, preventive tracking, and more. So instead of reacting late, you manage conditions early and reduce long-term costs significantly. Diagnostics is where most systems break. Tests happen, but action doesn't. Briea closes that loop. From home sample collection to AI-based interpretation to guided next steps, every report leads to clear action. Let me quickly highlight what makes Briea fundamentally different. First, proactive engagement. Second, multi-channel voice, chat, WhatsApp. Third, no app dependency. Full app works on WhatsApp too. Fourth, multi-language support. Fifth, integrated AI that understands full health context. Sixth, DIY plus coach model. Seventh, dynamic one-year care plan. Eighth, all India diagnostic services. Put together, this becomes a complete execution system, not just a solution. Now, all of this works only if employees actually engage. That's where Briea stands out. Voice makes it natural. WhatsApp removes friction. Proactive nudging ensures continuity. So adoption is not a challenge. It becomes a natural part of daily routine. From an employee perspective, this becomes a complete support system. Structured plans, guidance, motivation, family coverage. So instead of feeling overwhelmed, employees feel supported and guided, and you see a clear shift from stress to structure to performance. Now let's bring it back to business outcomes. With Briea, organizations typically see increase in productivity, reduction in absenteeism, lower attrition, strong ROI, and more. And importantly, these are measurable outcomes, not assumptions. Let me close with this. Every organization today is trying to improve performance. But performance is ultimately human, and human performance depends on health. So the equation is simple. Health drives energy. Energy drives productivity. Productivity drives results. The approach is also simple. Start small. Measure outcomes. Scale what works. The only question is, how soon do you want to start seeing this impact? Maybe now? Talk to us and move on.